Superintendent of Public Instruction said
Transparency,
yesterday,
while acknowledging the
continue to urge that public schools make their own decisions in consultation with local public health officials. Those decisions will be tailored to local needs, taking into account the differences between our densely populated and our rural areas. There are some factors we know our school division will take into. For example, schools build days into their calendar for snow days. But in most parts of the state, we have had a light winter, and those days should be available. Schools need to consider how best to serve their students with disabilities and make sure there are accommodations. And while rates of absenteeism are typically factored into our accreditation process, this emergency order will give authority to issue waivers for that requirement. I know students may have plans to leave the country for spring break, and schools are considering their risk level when they return. We know the private sector is also taking many similar steps. We know that their actions and ours will have economic consequences. The fourth action today is that I am directing our top economic officials to continue to assess how this will affect our economy and what we can do to mitigate that. Our goal is to get everyone back to work as quickly as possible. But make no mistake, protecting public health is our top priority. That is driving all of these decisions, and it will be the determining factor of all our decisions as this situation moves forward. Now, before I turn to your questions, let's talk for a moment about what you across Virginia can do. Many people are asking, what do I do if I think I have symptoms? The first thing to do is to call your provider. Doctors can order tests, and they will do. Primary care doctors can perform the swab, that is the initial part of the test. Our health department has communicated with our doctors and health providers about the steps to take after that. As you heard from the folks from the Medical Society of Virginia and the Hospital Association yesterday, our health providers and facilities are regularly providing guidance to their members. But remember, there are things you can do to protect yourself and others. If you are part of a high-risk population, that is, if you are older or have an underlying health condition, you should be especially cautious. Avoid large crowds and avoid traveling if possible, especially on airplanes. And for everyone, you have heard me say this before, wash your hands with soap and water, cover your mouth and nose when you sneeze, stay home if you feel sick, and avoid touching your face. We understand how critical it is to stay in front of this disease. While it is very likely to spread, our actions can help mitigate how fast and how far this virus spreads. It is our responsibility, every one of us, to take this seriously and to do our part to help limit the spread of this disease. I appreciate the legislators joining us. I know you all have had a busy day. I would remind all of you, this is a nonpartisan issue. We are all on board to make sure that we keep you, Virginians, safe. We also are all on board to make sure that we give you the most up-to-date and accurate information as it becomes available to us. I thank you all for being here again today, and I would be glad to address your questions. Yes, thank you, Laura. Dr. Pete.
So we have 17 people in Virginia now, or Virginians, that have been diagnosed with the novel coronavirus. 2 are in the central region, 4 in the eastern region, 10 in the northern region, and 1 in the northwest region. So of the 6 of the new cases today, were contacts of cases that we had identified. And while we were doing the contact investigation, we had identified them and they were tested. 2 others, as the governor described, were diagnosed in Texas. 15 in Virginia and 2 in Texas.
Good question.
We have not seen spread. We have not seen signs of community spread. So what that would mean is if we are testing people and we're interviewing them to get information about risk factors, and we don't find any, and so we don't know where it came from. So we understand now where people have acquired this virus, so traveling overseas and from other people that we know had the case. So in Virginia, 4, and the CDC is investigating this, and what they've done is to go back and look at the people who attended the cruises that were of concern, and they notified states of those individuals, and states have been reaching out to them to do monitoring. We're still working through that process now.
Yes. Well, I think a couple of things I would say, Alan. First of all, I want people to understand that we have been working diligently on this for weeks. Even in the case of pandemics, we have had plans in place. I think it's also clear that things have changed. Obviously, this has been declared a pandemic by the WHO yesterday. We have new cases in Virginia, just since I spoke to you all yesterday. And quite frankly, we're getting mixed messages from the federal government. We find that unacceptable. So I'm taking the lead on this, but we will do everything, continue to do everything in Virginia to keep Virginians safe. How much time do you have, Alan? We need to go back to biochemistry 101, I think, for that. But if you, I don't know any other. It's a very complicated process, Alan.
Yes, our university health systems are looking into that, and there's other private labs that are also looking at developing tests.
So just to follow up on that, so I think you said earlier there are currently 500 to 600 tests for the state lab to ask for more disease. What's the timeline for when there might be production of these tests?
Refer to Dr. Tony.
Welcome.
Thanks. Good morning. I'm Dr. Denise Toney. I'm the director of the Department of General Services Division of Consolidated Laboratory Services. So with respect to the test kits and the numbers that we've provided, when we have the capacity to do 500 to 600 tests, actually those are the ability to test 500 to 600 individuals. We oftentimes test multiple specimens per individual, so I did want to at least clarify that. With respect to the development of new tests, anytime there is an emerging infectious disease, there's a lot of information about the virus out there, the genetic sequences of the virus, the targets. All that information has been made publicly available by the Centers for Disease Control and Prevention. So laboratories that want to develop their own test have access to the targets that are being used in the CDC assay that the state lab is currently using, and so they can develop tests for use in their own lab, and those are called laboratory developed tests. They do have to apply for approval through the Food and Drug Administration to use those tests. The state lab is also looking at that as a possibility. However, because we do have access to reagents that are quality assured, approved through the Food and Drug Administration under emergency use authorization, and because we feel we have adequate test reagents now to be able to handle the testing demand, we are focusing on using those reagents that have been standardized and provided across the nation for all state public health labs to use. In the event that we become concerned that we cannot manage the testing capacity, we have experience and have brought up tests in our laboratory to be able to respond to emergency situations, and so we would be in a position to do that as well. And we are also working with universities, hospitals, as they are developing their tests, so that we are all in communication, working in partnership, and that when they bring up those tests, they are required to have their positives and their negatives sent to a laboratory such as the state lab to be quality assured, so that we have confidence in the tests that they are doing as well. So we will have a role in that. So it is multifaceted how this would play out as other labs start bringing up laboratory developed tests. I hope that answers your question.
So to protect individuals' privacy, we're not sharing information about individuals.
We have specific maps as well. I mean, we're obviously identifying and tracking where the cases are.
I mean, regular Virginians can't really know specificity where these cases are, for the most part, at a city level, or even a county level.
Well, I mean, I don't know how specific you want to be, but we can certainly look at the locations in Virginia where the cases have been identified, and that's public information. Yeah, obviously we're using discretion and looking at the risk factors and the symptoms, and we use that discretion to determine who is tested. Using those criteria, we have the test capability. Again, I can't predict. As I've said, this is a very dynamic process. I can't predict what's going to happen tomorrow, but if there are more cases, more individuals that need to be tested, obviously we will require more test kits in Virginia. And so while we can't definitely predict that, we can certainly anticipate it and do everything that we can to be prepared, and that's what we're doing.
Thank you so much.
Thank you all.